Turnaround Tuesday arose from seeing people hanging out on the street. So we went out and asked them, what would it take to get you off the streets? To a person, they said a livable wage job. Hence, we started Turnaround Tuesday. Over the last 3 years, we've helped 365 people obtain livable wage jobs. What we really are excited about is that 84% of those individuals are still working.
I was a medical assistant working through temp agencies, so that meant I didn't have stable work. When you are homeless because you don't have a lot of job stability, when you get to a point where it's hard for you to provide for your child's basic needs, you feel less than. And so I decided to stop in one day and I fell in love. I went through the 6-week session, and now I'm able to be employed through Johns Hopkins Hospital, where I am full-time employed. I've gone from being homeless to now having my own home, to being able to take care of my children, and that's because of this movement.
I do a lot of work in my job, but nothing gives me the satisfaction that working with Turnaround Tuesday and the program does. We've hired over 40 individuals who have been referred from Turnaround Tuesday. Many of these individuals have had challenges in life, whether it's been criminal convictions, whether they've had troubles with drugs and addiction, maybe they haven't had a lot of education and they've had a hard time finding employment. We believe in giving people an opportunity for a second chance. Just because they've made a mistake in the past, it doesn't mean that it needs to follow them forever in the future.
My name is William T. Glover Bay, and I'm currently working at Johns Hopkins Hospital as a floor tech. I maintain all the floors, and my area of work is the emergency department as well as the pediatrician department. When you're not working, easily feel like you're less than a man. And if you're not careful, the shame and guilt will eat you alive. To be employed, it feels exhilarating. Physically, emotionally, mentally, and spiritually, it is absolutely uplifting.
I love this city, but I tell you, it rips my heart apart when I see the neighborhoods, the conditions that people have to live under. I think that we are so much better. If you can garner the power and partnership of an organization like Hopkins and say to them, we will work with those people that you've turned down. We understand there are certain skills that they don't have that they need. We will work to get them those skills. What we're asking you to do, at least give them an interview.
The hospital has had a really terrific partnership with Turnaround Tuesday. Part of our mission is to provide care for our local community. So being able to hire from our local community is incredibly rewarding. And some of the positions that are filled by employees from Turnaround Tuesday historically have had very high turnover. Turnover is not good for patient care. And now we have a pipeline of dedicated employees who are wed to the mission, and many have been there 3 years or more.
What we know about workforce turnover is it's very costly. When you go to an employer and you say, I will be following up with this person after they're employed, I'll be checking in with them, they're going to be invited back into our space for more training. It's very different than just sending a list of names of people that we think have the skills to do the job. For us, getting a job may be the first step, but our whole goal is to move people into living wages.
Turnaround Tuesday, we believe, will be a model for Baltimore as a whole. We believe that we would change this city from a violent city to a city that's working, a city that's thriving, and a city that's successful. We are so proud to be the recipient of the Henrietta Memorial Award. Because of the story of her life and the impact it has had on so many others, we believe the work that we do is going to be impactful not just today, but in the future. And we believe that families will be changed, communities will be changed, and lives will be saved.